This is Sandy. Good morning, Sandy.
Good morning.
So you completed your dental treatment a little while ago, I believe.
Yes.
And how are your new teeth working for you?
They're fantastic. I love them. I have a great smile. I can eat pretty much anything that I want to. It's just a whole different way of life for me.
Wonderful.
So.
I know you and I have talked previously a little bit about your experience prior to undergoing treatment, your story, and if you don't mind, would you share a little bit of that with us?
Sure. Honestly, it was a mess. I had very active periodontal disease, gum disease, swollen, infected gums, bleeding gums, loose teeth because of that. It really was a mess. Consequently, I ended up losing several teeth. I do have 4 implants and 1 permanent bridge, and you know, it was just on my part, it was just not going to the dentist for many years, thinking that I couldn't afford it. In the long run, you will, not only is there a great deal of pain, limited foods that you can eat, you do not rest well. In the long run, you will pay with your health. It affects your overall health when you have active gum disease going on and loose teeth. So yeah, in the long run, you pay for it. So definitely go to the dentist. Even when you think that you can't, please go. And don't lose your teeth. Don't get in this mess that I was in and afraid to smile. I stand in front of a congregation every week. I'm a pastor at a United Methodist Church. And so it's nice to have the confidence to be able to open my mouth and stand in front of a congregation and not feel like I need to hide my teeth or don't smile, you know. So.
Wonderful. Excellent comments. Couple of other things. Do they look and function normal to you?
Absolutely, absolutely. The only time I really ever think about them being different is when I clean them. You know, flossing and brushing, and you floss and brush pretty much like you ordinarily would with all natural teeth. So, yeah, that's really the only time that I have to stop and think, oh yeah, I've got something different here. They feel like my permanent teeth, and they look like my permanent teeth, and they function that way. So yeah, they're awesome.
Excellent. You know, if I'm just thinking about quality of life, this has to have had, based upon what you've shared with us, this has to have had significant impact on your everyday quality of life.
It does. When your gums are swollen and your teeth and your mouth is hurting, that's all you think about. You know, you don't really think about what you're doing in your job. You always have to stop and consider, okay, I don't know if I can eat that because of this is hurting, this is swollen. When you lay down at night and you're trying to sleep, it really hurts. Even when you're trying to sleep, you take pain relievers, you know, over-the-counter pain relievers, and you think that that's going to help, and it does not. It just does not. Not when it's, you know, infected and that's swollen, and you've got an abscess going on over here, and you think, oh, there's just no rest. All you think about is this pain that's happening in your mouth. And it does affect your overall outlook on life, your attitude, your quality of life is diminished greatly. Recent research has shown us that it also affects your overall health, your cardiac health, diabetes, your blood pressure, and I'm going to even toss in there mental health, because that's all you think about.
Sure.
is this incredible pain that you have going on in your mouth and in your gums, and your teeth are loose, and it really does overall affect how you go through your day-to-day life. So.
Wow. Well, thank you for sharing that.
Absolutely.
Well, Sandy, I had the opportunity to follow you post-treatment now for a while, and I just think you have a great result.
I do too. I'm very happy with it.
Wonderful. And if I could, one final question. What would you tell someone else or other people who might be considering undergoing the same process that you've
Please
gone
go ahead and do it. It will be the best thing that you can ever do for yourself. It is not as scary or painful as you may think. Okay, Dr. Geyer and the staff are very good at making sure that the whole process is as pain-free as possible. Um, he does great post, follow-up as well to your experience. Don't hesitate to do it. At least call, come and see him, get some sort of idea of what needs to be done. Don't be afraid of it, okay? Don't be afraid of the cost. Don't be afraid of the procedures. It can be done, with very minimal pain. Please don't hesitate. It can be the best thing that you do for yourself. It really can. I'm proof.
Well, thank you, Sandy, and thank you for the opportunity
Yes.
to have partnered with you and Dr. Basinger to
Yes.
achieve your goals.
Absolutely. Thank you. I appreciate it. And please don't hesitate. Just do it. Just do it.
Good. Thank you, Sandy.
Thank you.